Hello, welcome to HMIS 104a, Custom Training of ShelterPoint for Singles. I'm your trainer, HMIS Program Specialist, Shantae Smith. During this training, we will be working in the ShelterPoint module within ServicePoint. This module is specific to those projects who want to track their daily bed utilization. We will go through the steps of checking clients who enter your project in and out of a bed. We will also work through some examples and a possible scenario that may occur. Please note that if you have any questions, to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into the system, go to the left side of your screen to the menu and locate the ShelterPoint button. Once you click it, the ShelterPoint dashboard page will appear. You will see a header that says View Shelter Inventory. Beneath that header, you will see your provider listed. And if you'd like to change your provider, meaning you have access to different projects, use the drop-down list to select the correct provider. And underneath your provider, you will see a list titled Unit List. Please keep in mind that your provider may have multiple unit lists available. You will select the appropriate list you wish to view and click the Submit button to the right of the Unit List option. The ShelterPoint dashboard provides different options of which you can use to check a client into your project, as well as other tools to help manage your project shelter inventory. The Check Client In button is used when you're ready to check your client into a bed at your project. The Express Check-In button is used when you're ready to check clients into your project. By using this feature, you're checking your clients into the first available bed instead of actually assigning a bed to them. The Check-In Referral button is used when a client has been referred to your agency through ServicePoint by another agency. The Hold All Empty Beds button is used very rarely. Your project has the ability to place a hold on all empty beds for a certain amount of time. The Print ID Cards button is used when you're able to print ID cards for your clients. The ID cards would then be scanned using specific equipment in order to track specific services provided. The Update Confirmation List button is rarely used. It is a feature that aids in confirming the individuals checked in your project shelter inventory. The Transmit Today's Checkout List button is used for shelter projects who do mass checkouts daily. Within this feature, you are able to check out selected clients all at once. The View All button is used when you wish to view your entire shelter inventory list. Now, please return to the home screen to work through our first example. As the LDRC shelter staff, you'll be checking clients into the project. So, let's go to our ShelterPoint dashboard to begin the check-in process. This is where you're going to double check to make sure that your provider and unit list is showing. Then, I want you to locate the Express Check-In button and click it. Once you do, the screen will change to show the unit entry data. You will see your header that says Entry Data, and below that header, you will see your provider listed and the type. It automatically defaults for you. Keep this in mind. Most of your clients will already have a campus ID card because they went through the Welcome Center. So, with those who do have their ID card, you will use the scanner to scan them in. To begin this process, you're going to make sure that your cursor is in the Client ID field, and then you'll take the scanner and scan your client's ID card or barcode. Once the scanner beeps, you'll see their name populate below the Express Check-In List window. Now that your person has been scanned in, you will continue to scan in clients who need an entry into the specific unit list, just by repeating the same steps that we just went through. Remember, if you accidentally scan someone onto the wrong list, you can delete them here by clicking on the red circle with the minus sign that's located next to their name. Or you can click on the button at the bottom that says Remove Last Entry. Once you're done compiling your list, you will click the Submit List button on the bottom right. And once you do, you'll be returned to your ShelterPoint dashboard. Now, let's work an example on how to switch to another unit list or project. So from here at the ShelterPoint dashboard, use the Provider drop-down list to select the correct provider. In this case, we will work with the Sandlot. Once I choose the Sandlot, my unit list automatically populates to the Sandlot unit list. Then you will work through the same steps we just ran through to check clients into your project. Remember, you're going to start with the Express Check-In button. Then your screen is going to change and you're going to scroll down to the Client ID number field and put your cursor right there in the field. And then you will take the scanner and scan your client's ID card or barcode. Now that I have all of my clients on this list, I'm going to click the Submit List button. This way it's going to return me back to my ShelterPoint dashboard, and now we can work through an example on how to view the populated unit list. So from here, there is a way to view your clients or your project's entire bed list. To do so, make sure that you have your correct provider listed, as well as the unit list you wish to view. And then once you do, click on the View All button. This will direct you to your project shelter inventory information page. This will show you the current list of clients that are checked into your project. If you would like to sort this list, you can do so by using the Sort option at the top right of the unit list. You'll select a category which you'd like to sort the list by, and then you will click Sort. Keep in mind that if needed, you can start scanning in more clients from this screen. Just look for the Start Express Check-In button at the bottom and click it. Once you do, you'll be directed back to that unit entry data screen to begin the process. Now return to your ShelterPoint dashboard page by clicking the Exit button, and then scroll to the bottom and click that button that says Return to ShelterPoint dashboard. Now that we're back to our ShelterPoint dashboard, let's work an example of how to check clients in that don't have an ID card. So from your ShelterPoint dashboard, I want you to locate the Check Client In button. Once you click it, your screen will change to reflect your shelter inventory information page, and a current bed list will show on the screen. So if a bed is open and not occupied, you will see on the left side of the screen a green circle with a plus sign, and on that same line, you will see that to the right of your screen, it will say empty. To check a client into a bed, you will use the green circle with the plus sign, or you can click on the empty link. We're going to click on the green plus sign because if you hover over it, you'll notice that it actually says check in. Once you click this, your screen will change to reflect the client search option. You're able to search for your client that is to be checked into this bed by their name or by their designated HMIS client ID number. Since we don't know our client's ID number, we're going to type in his name and identifying information and then click Submit to locate him. Once I type in his name that he reported to me, I'm going to complete the name data quality. I have the option to say whether his full name was reported, a partial street name or code name was reported, the client doesn't know, the client refused, and data not collected. Since our client gave us his full name, I'm going to say that the full name was reported. Below this, there is a spot to type in an alias. In the event that your client provided you with their nickname or street name or a different name that they go by, Please use this text field box to list it. Next, you will need to enter in your client's Social Security number. In the event that your client reports their Social Security number, please type it in these text field boxes. Then you will use the Social Security number data quality to tell us whether or not their full social was reported, or maybe they gave you an approximate or partial Social Security number, meaning they gave you the last 4 digits. Or maybe their client doesn't know, the client refused, or the data wasn't collected. Please keep in mind that the client doesn't know literally means that the client doesn't know the answer to this question. The client refused means that the client refused to provide you with this information. And data not collected means that you, as the interviewer, did not ask the question. This can be used, but just know that it's very rarely used and it's considered to be missing. So if you can, please try to avoid using it. Being that you're also working in a shelter, most of the time your clients are not going to report their Social Security number to you, and that is okay. So for this example, we're going to say that our client refused to provide us with their Social Security number. Then you have to answer the question, are they a U.S. military veteran? This is yes, no, client doesn't know, client refused, and data not collected. Our client tells us no. Once I have this information typed in, I'm going to click the button that says search so I can search for my client. In this example, our client does not already exist in the system. That's why it says no matches down here. Since our client does not exist, we have to create a brand new profile, and we're going to continue to move forward by clicking the Add New Client with this information button. Once you do, a warning box is going to appear, and it's basically asking you if you are sure you want to add this new client to the system. This is where you're going to click OK. As a side note, in the event that you type in a name and down here below there is a list of individuals, please check that list to make sure that your client does not already exist before creating a brand new profile. If your client already exists, please use the name that's listed down below by clicking on the hyperlink of the name, and it will take you straight to the client profile. Since our client does not exist, again, we're going to go ahead and add them to this system. Once I click Add New Client with this information, it populates his name down here. So to add him into our project, we're going to click now on this green circle with the plus sign to select him. This is where I'm going to be directed to the unit entry data screen. You will already see the date in, meaning today's date that they're being checked in. Then as always, you're going to see your provider and your type automatically defaulted for you. Now we're going to complete the universal data elements on the Maricopa UDE assessment. You will begin with the date of birth using the reported date of birth and 4-digit year. If the client did not give you a date of birth, just ask their age and approximate their date of birth by using the 0101 for the month and day. For example, if your client reports to you to be 30 years old, we're going to type in 0101 1985. And then we're going to list the date of birth type as approximate or partially reported. We can't list it as fully reported because they did not tell us the actual month and date. Then you will list your client's primary race and ethnicity. If you aren't sure how to define it, take your cursor and hover over it and it will provide you with the HUD definitions. Keep in mind that if your client reports to you to be of Hispanic or Latino descent, their primary race is white. Their ethnicity is Hispanic Latino. Our client reports to us to be of Asian, his race is Asian. But he also lets us know that he's an African American, so I'm going to list his secondary race as African American. But his ethnicity is non-Hispanic, non-Latino. Then you will list your client's gender. You have the option of female, male, transgender, male to female, transgender, female to male, other, and data not collected. You will list your client's gender to what they report to you as. In the event that your client reported something other than what's listed here, you will use the option as other and then use the text field box right below it to specify what other actually means. In this case, we're going to say that our client is a male because that is what he reported to us. The next question, does your client have a disabling condition? You will select yes, no, client doesn't know, client refused, or data not collected. And remember, try really hard not to use these three options because they can be considered as missing on the report. Our client tells us that he does not have a disability, so we will answer no. Then you have the question, residence prior to project entry. This literally means where did your client sleep the night before they came to your project? There are many options to choose from. You have emergency shelter, including hotel or motel, paid for with emergency shelter voucher, foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, hotel or motel paid for without emergency shelter voucher, jail, prison, or juvenile detention facility, long-term care facility or nursing home, owned by client with no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, place not meant for habitation. Please note that this can be used if your client slept on the streets, a car, in a park, or in an abandoned building. Then you have psychiatric hospital with other psychiatric facility, rental by client with no ongoing housing subsidy, rental by client with VASH subsidy. Please keep in mind that VASH is Veterans Affairs Supportive Housing. Then you have rental by client with GPD TIP subsidy. This stands for Grant Per Diem Transition in Place. Again, just keep in mind that these two are typically veteran projects. Then you have rental by client with other ongoing housing subsidy. This is in the event that your client was possibly receiving Section 8 or other types of subsidies. Then you have a residential project or halfway house with no homeless criteria, a safe haven, and please note that a safe haven is transitional housing for those individuals that are SMI. SMI meaning seriously mentally ill. Staying or living in a family member's room, apartment, or house. Staying or living in a friend's room, apartment, or house. Substance abuse treatment facility or detox center. Transitional housing for homeless persons, including homeless youth. Other. And again, if your client reports an other type of residence, please use the text field box below to specify what other actually means. And just below the other option, you have client doesn't know, client refused, and data not collected. Our client actually reported to us that he was sleeping in his car, so we're going to say place not meant for habitation. The length of stay in previous place. This question relates to the residence prior to project entry. For this question, we would like to know how long your client resided there. You have 1 day or less, 2 days to 1 week, more than 1 week but less than 1 month, 1 to 3 months, more than 3 months but less than 1 year, 1 year or longer, client doesn't know, client refused, and data not collected. Our client Jermaine said that he had been sleeping there for more than 3 months but less than a year. Then you have your question, zip code of last permanent address. Please specify the 5-digit zip code of the last place your client was housed for 90 days or more. If your client cannot remember the exact zip code, then please use the last city they resided in to complete this question. There is a cheat sheet, so if you take your cursor and hover over the question, you'll be provided with city and county zip codes. Please use one of those listed. Relationship to head of household. Since you work with singles, the answer to this question will always be self, head of household. Client location. This is the Continuum of Care code, also known as the COC code, that was assigned to Maricopa County projects. There's only one option in the drop-down menu. Please make sure that you choose it. Homelessness primary reason. This is where you're going to choose the reason of why your client has become homeless. We have aged out of foster care, client doesn't know, client not homeless, which will only be used for homeless prevention projects. Client refused, criminal activity, data not collected, domestic violence, economic, evicted, family dispute or overcrowding, loss of job, medical condition, mental health, move to seek work, natural disaster or fire, release from jail or prison, relocated, substance abuse, or trafficking and exploitation. Please note that there is a difference between domestic violence and trafficking and exploitation. If you're unaware of the legal definition of trafficking and exploitation, take your cruiser and hover over the question and we have provided it for you. Our client reported to us that he is homeless because of economic reasons.
Length of time on street in an emergency shelter or safe haven. These set of questions, along with other questions in the assessment, will help you determine if your client is chronically homeless. Please answer these questions on all heads of households and adults. Let's go over to the first question. Client entering from the streets, ES or SH. To the right, answer from the pick list, yes or no. Answer yes if the client is entering your project directly from a place not meant for habitation, an emergency shelter, or safe haven. Answer no if the client entering your project from any other location. Diversion and homeless prevention projects should choose no. So for this scenario, I'm going to choose yes. Answer the next question if yes for clients entering from streets, ES or SH, approximate date. If your client is coming from the streets, ES or SH, you should have the client look back to the last time the client was not on the street, ES or SH. I'm going to give you a few guidelines, you can call them rules, to answer some of these questions. If there was a break in their time on street, ES or SH, of less than 7 nights, do not count it as a break. It would be one continuous episode of homelessness. If the client experienced a break for more than 7 nights, count a break in between episodes. If a break in time was 90 days or less due to an institutional stay, such as jail, substance abuse or mental health treatment facility, hospital, or any other similar facility, that time should be included in the start date time. If the client was at an institutional stay for longer than 90 days, they're considered to be housed. If the client knows the month that the homelessness started, but not the exact day, use the day they're entering from your project with the month and year that they reported, because this is self-reported information. Documents in HMIS may be used only to jog the memory of the client, but cannot be substituted for information they provided directly to you. If the answer above was no, then just leave this question blank. So for this scenario, I'm going to say 10/9 of 2014. Next question. Regardless of where they stayed last night, number of times the client has been homeless on street in ES or SH in the past 3 years, including today. So please record appropriate answer for number of times the homelessness experience in the past 3 years for any combination of place not meant for habitation, emergency shelter, or safe haven. When counting episodes, please use the guidelines and the rules that I explained previously. Never in the past 3 years should be used for diversion or homeless prevention projects only. So from this pick list, you would choose never in 3 years, 1 time, 2 times, 3 times, 4 or more times. So for this scenario, I'm going to say 2 times. Total number of months homeless in streets in ES or SH in the past 3 years. So from this pick list, you would count the accumulated number of months a client was homeless and residing in one or any combination of these 3 locations in the past 3 years. Please note, any single day or part of a month spent homeless should be counted as 1 full month. So if it's more than 12 months, you don't have to calculate anything more than that. You would just put in more than 12 months. So I'm going to choose more than 12 months for this scenario. Then we have length of time homelessness, status documented. To answer this question, yes or no, indicate if there is documentation of the client's length of homelessness, either in the client's paper file or in HMIS for either the number of times homeless or number of months homeless in the past 3 years. So this is asking for proof. So you can answer it either yes or no. I'm going to answer it yes for this scenario.
Now, you will review all the information on your screen to make sure that it is correct. Then, look towards the bottom of the screen and click the Save and Exit button. You will then be returned to your shelter inventory information page. A really cool feature about ShelterPoint is that when you check a client into a unit at your project, a service of shelter stay will automatically be created. So to view this shelter stay, you can click on your client's name so that the unit entry data screen appears. So from your ShelterPoint dashboard, you're going to click that View All button to see your project shelter inventory information page. Then you're going to locate the client you wish to look at. And once you do, like I said, the unit entry data screen will appear. You're going to locate that Jump to Profile button by scrolling all the way down to their unit entry data screen and click the button that says Jump to Profile. And then a warning box will appear asking if you want to leave the unit stay entry data screen to go to the client's profile. This is where you will choose Yes. From there, you're going to be directed to your client's profile. So then you're going to locate the tab that says Service Transactions at the top right and click it. Once you do, you'll be directed to your client's service transaction dashboard. This is where you're going to locate the button that says View Shelter Stays and click it. Your screen is going to direct you then to your client's shelter stay history. To get back to the service transaction dashboard, click the Back to Dashboard button at the bottom right. So please note that when checking a client into a bed, it automatically creates the project entry. This can be viewed on your client's profile inside of the Entry Exit tab. So if you're on the Service Transactions tab, go to the Client Information tab and locate the Entry Exit tab. Once you've done so, you will see that your client has an entry into your project. If you accidentally checked the wrong client into a bed, there is an easy fix. You will go to your shelter's current unit list and click on the client's name. So from here, you can go back to ShelterPoint, locate your correct provider and unit list. Then you will click View All to see your shelter inventory information page. And then you will locate the client and click on their name. Once you click on their name, you will scroll down to the bottom of the unit entry data screen and locate the button that says Delete this shelter stay. Once you click it, a warning box will appear asking if you want to delete this shelter stay, and this is where you will click Delete. If you happen to run into an issue like this, please don't hesitate to contact the HMIS support team at the HMIS Help Desk. We will assist you in correcting the mistake. So from here, I'd like you to return back to your ShelterPoint dashboard. Now, let's work through an example of how to check clients out of the project using Transmit Today's Checkout List. So, when you're ready to check your client out of the bed that they were assigned to, you will begin with the Transmit Today's Checkout List button. Once you click it, a new screen will appear with a list of clients currently checked into your project. At the top of the screen, you will ensure that the correct checkout date is listed correctly. If it is not, please change it yourself and click the button that says Set Dates. Next, I want you to notice how each client will have a date of checkout, as well as the defaulted reason for leaving and destination. The exit destination is very important for project outcomes. So if you know where a particular client is exiting to, please list it accordingly using the drop-down list. Please keep in mind that there's many options to choose from. Make sure you're choosing the appropriate one that they actually exited to. Once all changes are made, go to the bottom of the client list and locate the Check All button. By using this button, it will checkmark all of the clients exiting from the project. After clicking that button, locate the Check Out button and click it. This will remove all clients from this unit list and create an exit date from the project. Let's take a moment to look over the summary. These are a few key points that I would like you to remember. In ShelterPoint, your provider will have more than one unit list option. Remember, the Date In field must be the client's actual check-in date. Also, when checking clients in who have ID cards, you will check them in using the Express Check-In option. But for your clients that don't have an ID card, you will check them in using the Check Client In option. Remember, to view your project's entire bed list, you will use the View All option on the ShelterPoint dashboard. Once you check a client into a bed, an entry date will be automatically listed on your client's profile Entry/Exit tab. For the clients that do not have an ID card, remember you will need to complete the Maricopa UDE, Universal Data Elements, assessment when you check them in. And lastly, when your client exits your project, you will change the destination to what they report. If they do not report anything to you, you can leave it at the defaulted destination. By following these steps and working through the examples and scenarios, you've completed training on HMIS 104a, Custom ShelterPoint for Singles. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.